Hey y'all, Shelly here with another tip for hospice nurses. So have you ever had a patient who is doing some rhythmic humming or moaning, kind of and you can't tell if they are in pain or what's going on, but they don't have any signs of pain. They don't have any facial grimacing, no frowning, no guarding. They're not tense. Their body is relaxed. They appear comfortable. They're not diaphoretic. Their blood pressure and heart rate are within their normal range, whatever their baseline is. No signs of anything that is causing them pain. And you can't, but they just continue to do this. This could be something that's called self-soothing vocalization. There's not a lot of information out there, but this is something that people will use sometimes as a form of emotional autoregulation. So they'll do this humming and this moaning. I think it's the vibration and the sound that it just helps to calm them, or it is peaceful to them. Sometimes you might see babies do this. I've seen little small children do this before. I also saw this sometimes when I worked in the neuro intensive care unit. Some of our patients would do this too. But I do see this in my hospice patients from time to time. And usually it's either patients who have a neuro disorder, whether it is severe cerebrovascular disease and they've had multiple strokes, or it could be a brain tumor. But I also see it in patients with no neuro issues, but that are kind of pre-transitional. So they're not transitioning yet, but they are in that phase right before where they have started to withdraw and they're not really communicating. And they may start doing this humming or this moaning. Now this can be really stressful because a lot of times it does sound like they're in pain. But if you've done the full assessment and you've done a careful assessment and there's no indication that they're in pain, consider that this is what it could be. Now, some people do it very quietly. Some people do it really loudly. Some people do it quiet, then loud, then quiet, then loud, in this kind of up and down pattern. What I have found that helps with some of these instances is using a white noise machine or some kind of white noise. You could use the app on your phone, but putting a little bit of the white noise in the background seems to bring the volume of the humming and moaning down, because I think the person probably finds that somewhat comforting as well. And if we can bring the volume down, it's not as stressful on the family. I do like to educate families about this. Sometimes I do this during the admission process, just so that they know this could happen. And if it does, they're like, okay, well, Shelly told us about this. So, even though it's a little stressful, we know that the person is not in pain. So if you've ever experienced this, share what you've done to help with it here. And if you have any other tips for hospice nurses, also please share them here, because y'all remember, if we work together, we can change our world.